Hi, it's Dr. Anna Toker here, and we're here to talk about the consent for neurotoxin injection. First of all, what is a neurotoxin? Well, a lot of people will refer to this as Botox. There are several neurotoxins on the market, but they all basically do the same thing. They block the signal from a nerve to a motor end plate in a muscle, which basically means that you can temporarily paralyze a muscle of your choosing with an injection of a neurotoxin. In medicine, we do this for a number of reasons: to stop muscle spasm and diseases associated with muscle spasm. In aesthetics, however, there's no disease that we're treating. This is completely an elective use of this neurotoxin. But what we are trying to do is decrease the strength of a facial muscle that is responsible for causing an unwanted crevice or wrinkle on the face. So in other words, scally face, that right there. Am I making it? Okay, yeah. That thing right there. Some people don't like that, or it's very prominent in patients and it bothers them. And so they ask for a neurotoxin injection to get rid of that scally face and that deep-seated wrinkle. Now, one of the things that's real important to understand is that Botox is not a filler of wrinkles. We don't inject it in there to smooth out the skin. We inject it to soften the muscle. There are a number of different ways that we use that. So we use that in this area here. We use it in the crow's feet area here. I need Botox. So anyway, we'll minimize wrinkles up here. I'm an old lady, so you can see this nice. These platysmal bands you can also soften. Some people will have a real prominent masseter muscle. You can soften that. A little bit of these dimples are caused by a chronic muscle contraction of the chin. All those things can be treated with little bits of injection of Botox here and there to soften up those muscles. So that is what a neurotoxin is and why in an aesthetic clinic you would want to have it injected. The next question is, how is it injected? And so we have tiny little needles. Let me see if I can find one. Got one right here. We've got these little syringes and these tiny itty bitty needles. Where's the camera? There it is. Somewhere in there. There's a needle. Teeny tiny little needle. And we use that to inject directly into the belly of a muscle. Let's say, for example, we're talking about between the eyebrows. There's this triangular muscle right there. And then two little sort of trapezoidy muscles there, and we would inject that stuff right into the deep bellies of that muscle, and then superficially in the little lateral part of that little muscle there, to make sure that we get the muscle that causes that skin contraction. If you inject it too superficially or you inject it too deep, you will get the wrong muscle. So one of the ways you can get bad Botox is by injecting the wrong muscle. Some people, when you complain of wrinkles here, will inject just a little bit too high. They'll miss the muscle causing the wrinkle, but instead will hit the forehead muscle, and that'll cause the patient's face to sort of droop. That's an unintended consequence of Botox. If you have Botox, even if it's well placed, but you massage it in place because you go have a facial shortly after having your Botox done, you might massage that neurotoxin a little bit too deep and all of a sudden have an eyelid that doesn't lift up, or again, the heavy brows, or like a shocked face and look like that. There's a bunch of different weird things that can happen with Botox. The good news is that almost no matter what the situation is, it's a temporary effect. Botox will last as little as 4 weeks in some patients and as long as 6 months in others. We never really know how long it's going to last. So one of the questions that we will ask is if you've ever had Botox. Did you have a good response to it, a bad response to it? How long did it last? Have you been using it for a long time? Some people will find after a long time that the effect will be of shorter duration than when they first started using it. It's one of the reasons there's more than one toxin on the market, so you can rotate those around if you want to. Each are slightly different, and you can ask us which one you think is best, which one we think is best for the condition that you're concerned about. Finally, things that we would want to know before injecting Botox in you is, number one, have you ever been allergic to Botox? There are some people who have food allergies, in particular to eggs or milk, that may develop a little bit of a reaction to certain of the brand, Botox in particular. On those patients, we might use either Xeomin or Dysport. Is the first thing. The second thing is, do you bruise easily? Are you on aspirin or a blood thinner? This is an injection, and that injection can cause bruising. And the kind of bruising where you really don't want to press or massage on a bruise to try to get rid of the bruise, because then you'll manipulate the toxin deeper into the tissues to a place we don't want it. So we would want to know that. We would also want to know what medicines that you might be on if you're pregnant. And if all those are systems checked, then we give you a green light for the injection. 2 weeks after that injection, we'll make you come back so we can see how you are doing. Our intended purpose is to soften the appearance of your face to make it more open, more balanced, and more natural. We don't want you frozen, and we don't want you looking like an alien, and we don't want you looking like Spock. So we want to see how we're doing and how your response is to Botox. And at that time, typically 2 weeks later, if we have to add a little to sort of balance things out, we can do that at the same time. Alrighty, so if that's what you want to have done, we're here for you. You're going to have to meet with me personally, by phone, or in person to ask the rest of those questions and sign off on that. And then you'll meet our nurse injector, Tanya, who'll be happy to do that for you. All right, have fun.